When we start discussing imaging, one of the first questions people ask is usually, do I need an MRI? The answer is not always. In many mild to moderate cases of rotator cuff related shoulder pain, physical therapy often begins before any imaging is performed, and this is completely normal. Many people improve significantly with conservative treatment alone and never actually need any further imaging. Typically, if symptoms are not improving after about 4 to 6 weeks of consistent physical therapy, it may be then appropriate to consider imaging to better understand exactly what is happening in the shoulder. The purpose of imaging is not to scare you. The goal is to simply gather more information so treatment can be guided as effectively as possible. MRI is considered the gold standard for evaluating the rotator cuff because it provides detailed images of the tendons and surrounding soft tissue structures. However, musculoskeletal ultrasound is becoming increasingly popular as well. Ultrasound is significantly less expensive than MRI and still can provide excellent visualization of the rotator cuff. It is often able to identify tendinitis, impingement, and even rotator cuff tears very effectively. It is also important to understand that standard X-rays or radiographs do not directly show the rotator cuff tendons. X-rays are useful for evaluating bone and joint structures, but they cannot provide definitive answers regarding rotator cuff tendon injuries. Once imaging helps identify the specific issue, physical therapy can be better tailored to the injury. Conditions like tendinitis, impingement, and many partial thickness tears often respond very well to conservative treatment and physical therapy. In cases of larger or full thickness tears, referral to an orthopedic specialist may be appropriate for further evaluation and discussion of additional treatment options. Now that we've discussed imaging and how it fits into the rehab process, let's start talking about exercises you can begin doing at home to address your rotator cuff symptoms.